So hello everyone, good morning once again. Yes, I hope you're all fine. Okay. So hello everyone. All right. Good morning, good morning, good morning. Sorry about that. So I'm going to talk about something very important, and I think today's a wonderful time. I hope you're having a wonderful morning. Don't forget to share this video to your loved ones and friends so we can all learn together. Today I'm going to talk about something that usually happens every month and almost every lady in their reproductive age may have experienced this one way or the other, usually in the months, and they are always expectant of what is about to happen in the month. And I'm talking about menstruation. But I'm not going to focus on menstruation necessarily. What I'm going to focus on more is the cramps that comes with it, the menstrual cramps. So we are going to talk about menstrual cramps. So share this video to your loved ones and friends and let them join this video. So and today is 2028, right? Yeah, today is 28th of August 2026, and usually it depends on when they have their menstruation. So some can have it at the early part of the month, in the middle part of the month, or the later part of the month. But ideally, it's usually at the latter part of the month. That's where ladies usually have their menstruation. So today we are going to talk about menstrual cramps and how to kind of reduce the pain that they have. If you have been with a lady before, usually in their menstruation phase, they always complain about menstrual cramps. Menstrual cramps. So that's what I'm going to talk about today. So now, what we call menstrual cramps. So what we call menstrual cramps is called dysmenorrhea. Okay, dysmenorrhea. Dysmenorrhea. Menorrhea means bleeding. Dysmenorrhea is dysfunctioning of the bleeding. Okay, in other words, painful bleeding or painful menstruation. So that's what we call menorrhea. Do you get it? All right. So share this video to your loved ones and friends. As I said, I'm going to talk about it, and we're going to learn a lot of stuff today. So let's go. Yeah, thank you all so much for joining. I hope you're having a wonderful morning. Good morning once again for having time to join this live, and I really appreciate it. So let me know where you are watching us from. Let me know where you are watching us from. I'm Dr. OPJ Hub. I'm Dr. OPJ from OPJ Hub. And shout out to all of you. You can leave a comment in the comment section. I want to know how you are doing today. All right, great. So we are going to talk about the menstrual cramps, or what I refer here as dysmenorrhea. It's happening mainly because during the menstruation phase, okay, the uterus try to contract. The uterus is a muscle, and it try to contract. Okay, so the uterus is a muscle, okay, and muscles contracts and relax. And so what happens is that the uterus also contracts and relax. But then during the menstruation phase, the uterus contracts, and the more it contracts, it produces or releases some chemicals called the prostaglandins. And once the prostaglandins are released, um, it makes the uterine muscles contract more and more, and the more they contract, the more the contractions, the more blood flow reduces there temporarily, and the more the person have pain. Do you get it? So that's basically what I'm trying to point at. That's what we call the menstrual cramps that they usually experience with. So I'm going to show you six practical. I'm going to show you six practical ways that can, or some practical ways that can help you anytime you're having a menstrual cramp. This is not necessarily so, it's the natural way because blood flow should be natural. Every month should be natural. That shows how healthy a woman is. So I'm going to show you the six things you need to know. All right, this one is you to apply some heat to the lower abdomen. These think of it as like uterus is contracted, and so you're trying to cause the uterus to relax. So you can apply some um, warm water. Maybe you can put some cloth in water and then soak it slowly and then apply it at the lower abdomen. It is not, it's just a natural way of trying to reduce the pain. So you just put it there and for a while, for some minutes, just to allow the, the uterus is contracted, just trying to make the uterus relax. So in so doing, reduce the pain the person is having. So that's one way of actually reducing the menstrual pain. Do you get it? Basically that. Okay, so with that said, let's look at another way that you can help reduce the menstrual cramps or the menstrual pain is, you know, taking NSAIDs, NSAIDs like ibuprofen and all those pain medications. Okay, it is known for a fact that these pain medications kind of reduces the release of the prostaglandins. Don't forget, I said the prostaglandins that causes the muscles of the uterus to contract more and more and more. So the more there's prostaglandins, the more there will be contraction. So when you take NSAIDs in the early parts of the menstrual cramp or before the menstrual cramp starts, it is shown for a fact that it reduces this pain um, gradually. However, and I repeat, however, if you are having issues with stomach ulcers or kidney problems or NSAIDs allergies or any reactions towards these medications I've mentioned, don't take them. And when you abuse these painkillers over and over and over time, you can develop what we call stomach ulcers, and that is also not good. So, in the case of you are reducing the menstrual pain or menstrual cramps, you're actually causing another disease. So, it's not advisable. You need to be taking painkillers without your doctor's prescription or without your pharmacist agreeing to that. So, with the painkillers, I don't really support that, but randomly you can take that just to minimize the pain. And I told you the mechanism is to reduce the prostaglandin release. Does it make sense? Does it make sense? Exactly. So basically, that's what I'm trying to say. Okay. So let's look at the next one. We can talk about. So the next thing we can talk about is exercise. Now, exercise has been known to be one of the natural, cost-effective way of reducing pain. So if you have menstrual cramps, one of the things you can do is exercise. Just a small, simple walking about, um, jumping around, skipping a rope, or doing some press ups or push ups, all can help reduce the pain, the level of pain you're feeling. It can kind of dampen the pain small. So that is one way if you're having menstrual cramps. It's not just for you to uh, complain about, shout about. I know I've not experienced that before, but then I think exercise helps in reducing pain. It sends them, when you're exercising, there's some hormones released, the dopamine hormones are also released that makes you feel good. I don't know if you have ever done an exercise and after you finished the exercise, you really felt good. So that hormone makes you feel better. And so once you're having the pain or the menstrual cramps, that hormones comes to overshadow, and then you feel better. Do you get it? So I've mentioned three things now. First of all, what did I mention? I mentioned the use of water-based stuff to dampen the pain, and I've mentioned of NSAIDs painkillers. However, I gave a strong caution about the need for using painkillers. And the third one I just mentioned right now is what? Exercise. So you need to exercise, and exercise has been shown to reduce pain in so many ways. So if it's um, kind of you are having some difficulty concentrating, you are bearing some pain emotionally, physical pain, whatever pain that may be, one of the strategy or natural remedy for reducing that pain is when you exercise. Okay, so try this at home. Anytime you feel something is paining you, when it's emotional, physical, whatever it may be, just try and create an atmosphere where you exercise and see whether the level of pain you are having will be the same pain after the exercise. Try this at home. Okay. Now I'm going to show you the next one. Stay hydrated. Now this is also very important. You need to stay hydrated. So whilst you're having a menstrual cramps, you should not just focus dwell on the cramps or the pain, but you need to also stay hydrated. Because don't forget, it's the muscles contracting and contracting. And because of that, blood supply is not reaching to the uterus as it is or it initially does. And so once you take water, water helps because oxygen binds with the red blood cells, moves in your bloodstream, and supply oxygen to the tissues, the muscle tissues. And the muscle tissues receive this oxygen and help contracting and relaxing and function of the muscle. So when you take a lot of water or you hydrate yourself, you actually allow the blood to flow, circulate very well. So enough oxygen reach the muscles, and enough oxygen reaching the muscles will help the muscle also relax. In so doing, reduce the pain you're actually having. So basically, that's what I'm trying to say. So hydrate enough and hydrate enough. So anytime you're having menstrual cramps, I've mentioned the first one, you can use a water bath. Two, you can take some pain medications earlier, because if you know you are going to have your menstrual cramps in 3 days to come, then maybe the second day you should take your painkiller. That will help reduce the prostaglandin release, and once the prostaglandins are reduced in their production, the contraction will also be reduced, and then enough of it, you will not have your menstrual cramps. Then the third one I talk about is exercise, and then I just mentioned the fourth one, which I said was hydrate. Let's add the last two ones into it. Just quick. So share this video to your loved ones and friends. So all right, thank you so much. Let me know where you're watching us from. You can drop it in your comment section. Thank you so much for staying true. I really appreciate. Oh, okay. So now there is another thing. The fifth thing I would like to mention is sleep and relaxation. Now, adequate sleep, adequate rest, adequate relaxation has been known to reduce pain. Yes, it's true. I don't know if you have been ever, let's say you have been beaten by your teacher or maybe your parents or something, and you are crying, you're crying, you're crying, crying, then all of a sudden you don't know when you slept. You slept, and then you woke up and you're feeling so good. You're feeling so like the pain, there was nothing like pain anymore. Like your whole body yes. So it has been shown that when you rest, when you relax, when you avoid stress, the pain also reduces. So once you are having your menstrual cramps, okay, once you are having your menstrual cramps, I want to repeat that again. Anytime you're having your menstrual cramps, try as much as possible to avoid things that stresses you. All right, and also try as much as possible to have enough sleep. Spend about 7 to 9 hours every day sleeping, and that will help your body to rejuvenate, help reduce stress. Quality sleeps helps reduce the pain you're having. So anytime you're having your menstrual cramps, make sure you have, those are the days you should have good sleep, good time in bed. Poor sleep, more pains. All right, I hope this was helpful. Let's look at the next one. I hope this was helpful. Okay, so sleep more, pain less. All right, so let's look at the next one, which is going to talk about is now, what I'm going to talk about now is going to be red flags. Red flags. Okay, so share this video once again. Now, when you notice that this pain is severe and very severe in such a way that it even stops you from going to work, going to school, going to the marketplace, doing your daily activities, then it's a red flag. You need to report to the doctor as soon as possible. Are we together? Yeah. Now, I'm going to say the second thing here. All right. Now, there's another thing I would like you to know. When you are having your menstruation and you realize that you are changing your pads like for 5 times or so, and the bleeding is heavy, heavy bleeding with clots within it, that is also a warning sign. It's a red flag. You shouldn't sit at home and say that you are fine, you are normal,